When clients seek my help, first we have to agree I'm not diagnosing, treating, or curing disease. Now, what the heck does that mean? If not that, then what are we doing here? Hi, Dr. Wade Binley here, bringing you my latest information on functional healthcare and the IB Solutions method. Today, I want to talk to you about the difference between looking for root causes of disease and illness versus only treating the symptoms of illness and disease. At the end of this video, I'm going to tell you how to work with me if you need some help. Now, to clarify this whole concept, I'd like you to imagine a train wreck. In a wreck, the disaster is right there. It is obvious. People are hurting. Everyone is busy trying to clean up the mess. It's horrible. And anyone involved wants the catastrophe fixed as soon as possible. Now, in chronic disease, symptoms are like the sight of that train wreck, painful and messy and urgent. If you're the one suffering, getting rid of the symptoms is the whole point, isn't it? Otherwise, why would you be looking for any help at all? But there is still a very important question to get answered. Where did the train go off the track? Why did it crash? Now, if all we do is clean up the messes, how are we going to prevent another horrible wreck from happening? This why way of looking at a train wreck describes what makes functional medicine, at least in my own method, different from Western allopathic medicine. Instead of only cleaning up the immediate mess, I am interested in asking, where did your train of health jump off the track, and why did it do so? Symptoms are not my primary focus as a practitioner of functional healthcare. For one thing, I am not a medical doctor, and I do not diagnose nor treat or cure disease. What I do is I look for the root causes of illness. This is very different from chasing symptoms. What I do is look way further up the track of your life, and I am searching for the places your health train may have first gone off course. And to find those origins, I'm going to focus on your systems, not your symptoms. We will begin your journey with the proper first step, which is testing for the 6 root causes of chronic disease. All chronic disease is caused by one or more of the following 6 causes. Unresolved trauma, allergies, both acute and delayed, microbial imbalances, including yeasts, bacterial, viral, and parasitic infestations, nutritional deficiencies, genetic variability, and toxic exposure. Number 1, unresolved trauma. Trauma causes your body to mount a stress response to protect you, because in a traumatic situation, you have to be ready to either fight or run. This is known as the fight or flight response. If a bear is chasing you, that's exactly what you need to do. All forces in the body that are not enabling you to fight or to run are basically shut down, and that's the way it's supposed to be. In modern day living, this kind of trauma is not very likely to come from a bear, but it could be coming from a head injury, a serious illness, or even long-term stressful and emotional situations. Once the trauma is past, your body is designed to then shut off that stress response, stop the fight or flight mode, and to reactivate a wonderful nerve called the vagus nerve, and to get back to rest and digest, which is also known as the feed and breed neurological system. However, some people can get stuck in the fight or flight, which results in the body operating out of unresolved trauma mode. This can dramatically affect all of your hormone and neurotransmitter functionality, including the levels of serotonin and dopamine and GABA, as well as elevating glutamate. Also, your body's blood supply is shuttered from your organs, leaving them deprived of up to 50% of normal blood supply, compromising the operation of your colon, your organ systems, the sleep and wake cycles, and all other types of systems as well. It's as if stress is a foot at the throat on your vagus nerve, choking it off, never letting it reactivate so that you can calm down, and never getting back to rest and digest and breathe. And until the damage from trauma is dealt with, the body continues to hold it, to protect you from it, so to speak. If trauma goes unresolved and its damage remains unfixed, your health can suffer in many dramatic ways. Number 2, allergies. What would happen if you continually poked a sleeping bear with a pointed stick? Just little pokes, but constant and relentless. Can you see that bear eventually waking up with a roar and causing all kinds of mayhem? Well, this is what it's like to consume or expose yourself to what you're allergic to. At first, your body may shrug it off, but eventually your bear of an immune system will awaken, and it will not be happy. Allergies can be acute, in which case you're probably already aware of them, like an allergy to cats or shellfish or peanuts. But you could also have subacute allergies, which cause a delayed immune response. Now, because these effects might be seen right away, connecting the symptoms with the subacute allergens can be tricky, and you can go on for years consuming things or exposing yourself to things that you are actually allergic to. The end result is tissue damage. When I did a delayed immune response allergy test on myself, I was shocked to find out that I was allergic to several items I was eating and being exposed to on my home on a very regular basis. I was definitely poking my own bear until I knew better. Number 3, microbial imbalances such as bacteria, viruses, parasites, yeasts, and molds. No one wants to think that they are walking around with worms or bugs in them, or pathogenic bacteria, mold, yeasts, or viruses, especially not in their gut. However, I have seen many a sneaky parasite or an infection such as Epstein-Barr, Klebsiella, E. coli, C. diff, H. pylori revealed to be at the root of chronic illness and continues to drive them in our lives. Many times, these bad guys are masquerade as other things as well and remain undetected unless they are specifically tested for. An example of this is Lyme disease, which is now pushing epidemic status in the United States. Yeast that's out of balance and toxic molds also fall into this category. Number 4, genetic variability. Does your inborn genetic makeup cause you to activate inflammation from grain proteins? You might be surprised to find that over 90% of us do. This is just one of the genetic variables that can be tested for. Others include your potential for your detoxification pathways, MTHFR, and many other tests that are actually designed to evaluate the predisposition to chronic diseases such as Alzheimer's. Number 5, nutritional deficiency. This is another tricky masquerader. A lot of diseases are actually simple nutritional deficiencies, and they respond well to supplementation. Now, among these can be chronic fatigue, anxiety, depression, fibromyalgia, and systemic inflammations. All of these have roots in nutritional deficiencies. These are actually just the tip of a huge iceberg of conditions, and it is also very important to note that many deficiencies can be actually caused by prescription medications. And number 6, toxic exposure. What did you have for breakfast? How about some molds, solvents, heavy metals, bisphenol A, pesticides, herbicides, industrial chemicals, Roundup, and pollutants? Not to mention that man-made EMFs amplify the toxic effects of each one of these toxins that circulate and are trapped inside of our body's tissues. None of these are on anyone's ideal breakfast menu. However, thousands of pollutants and toxins such as these that I have just mentioned have been identified in common foods, like coffee or a popular O-shaped cereal, as well as ordinary household products and personal care items such as shampoo, as well as makeup. Even newborn babies' umbilical cord blood has been tested positive for over 200 of these pollutants, so you can assume that you have your share of them in your own body. We have inborn mechanisms to process and detoxify these toxins, but this toxic overload harms us in many ways. And if we do not overload our systems, or we are genetically less capable of detoxifications, or if our system is already compromised in some way, like with a chronic illness, then we can get in a big hurt of trouble with these nasty toxins. So to recap, there are 6 root causes of disease. Number 1, unresolved trauma. 2, allergies, both acute and delayed. They lead to tissue damage. Microbial imbalances. Number 4, genetic variability. And number 5, nutritional deficiencies. And number 6, toxic overload. Now, if the starting point of evaluating your chronic illness has not included a discovery process of these 6 root causes of disease, then I don't think you've been properly evaluating today's healthcare delivery systems. Does this make sense to you? Have you been frustrated by so-called healthcare system that just rushes you out the door with a prescription in hand, but never finds out why you're ill in the first place? If what I'm saying is ringing a bell with you, please give me a thumbs up and leave me a comment. I want to know what you think of all this. And please share this with someone that you know needs to hear it. Now, I consider this type of evaluation a baseline necessity with every client, especially when someone has been searching for answers for a long time, going from doctor to doctor without any success. You see, a new baseline must be set by going back to the beginning to know your why instead of just jumping in to clean up the mess. We have to find out where your health train jumped off its track in the first place. I don't think it serves anyone to start guessing and trying this or that, hoping we hit a target that hasn't even been identified. Now, in my practice, I use very specialized functional lab tests that are designated to uncover all 6 of these root causes of disease so that my clients understand their weaknesses and insufficiencies as well as their strengths. The starting point is defined and very clear. We lay out in an orderly progression and we retest to be sure we have reached the goals that we set to reach. Now, there has to be a proper start, middle, and end to all treatments. Proper functional testing for the 6 root causes of disease is just the beginning. Please don't settle for anything less. This is Dr. Binley. Thanks for spending your time with me today. Remember to subscribe to my channel and hit the bell so you get notified and you don't miss any of the new health information that I put out on a regular basis. I've left a couple of links in the description below for you. First, to my website where I've put more information out like this to help you. But also, there is a link for you to reach out to me if you're still searching for help and not finding any. You see, I consult with clients of all ages, all over the map. And if I can be of service to you, it would be an honor to do so. So don't settle for getting shuffled around from doctor to doctor, always getting told, try this or that. Get to your own root causes, and you deserve that.